The osteoarthritis is a common condition affecting millions worldwide, especially as we age. It causes pain, stiffness, and limits mobility, impacting daily life. Many people seek relief through surgery, hoping for a solution to their discomfort. But recent research has raised important questions about whether surgery is always the best option. In this video, we'll explore new findings, discuss alternatives, and help you understand what might really help with knee osteoarthritis. Let's begin by looking at the basics of this condition and why treatment choices matter so much. For years, partial removal of the meniscus cartilage has been a widely practiced surgery for knee osteoarthritis. Many doctors believe this procedure could relieve pain and improve function. The meniscus acts as a shock absorber in the knee, and its damage was thought to be the main cause of discomfort. However, new evidence suggests that this surgery may not always deliver the expected benefits. In fact, it could even worsen the condition for some patients. Understanding why this happens is crucial for making informed decisions about treatment. A recent study from Finland followed people who underwent meniscus surgery and compared them to those who had sham surgeries. Surprisingly, those who had the actual surgery fared worse over the next 10 years. They experienced more pain, less knee use, and greater progression of osteoarthritis. Meanwhile, the sham surgery group had better outcomes with less pain and improved knee function. These results have sparked a reevaluation of surgical approaches for knee osteoarthritis, highlighting the need for careful consideration before opting for surgery. Meniscus is a tough, C-shaped cartilage in the knee, providing cushioning between the shin and thigh bones. It can tear from sudden twists or simply as a result of aging. Most older adults with knee arthritis also have meniscus tears, but not all experience pain. It raises questions about whether the tear itself is the main source of discomfort. Experts now believe that meniscus tears are often visible but may not be the sole cause of pain, especially in middle-aged and older individuals. For years, doctors assumed meniscus tears were the main cause of knee pain. However, new research shows that pain may stem from other factors, such as inflammation and chronic changes in the joint. Cell mediators like cytokines, interleukins, and enzymes play a role in pain and may be more significant than the tear itself. This evolving understanding is changing how experts approach knee osteoarthritis, focusing more on the underlying biology rather than just visible damage. Orthopedic specialists like Dr. Clint Sopp and Dr. Teppo Yevain emphasize that meniscus tears are common, even in people without symptoms. They argue that the tear is often not the main driver of pain. This perspective is supported by anecdotal reports from patients who have undergone meniscus surgery, many of whom experience worsening pain and mobility over time. Experts now recommend a more cautious approach, considering alternative treatments before surgery. Over the past few decades, our understanding of chronic pain has advanced significantly. Researchers have identified various cell mediators, such as cytokines and TNF-alpha, that contribute to pain in knee osteoarthritis. These discoveries have shifted the focus from structural damage to the complex biological processes underlying pain. This new knowledge is helping doctors develop more effective, targeted treatments for knee osteoarthritis. Surgery may not always help. What are the alternatives? Experts suggest giving knee pain time to improve, using anti-inflammatory medications, physical therapy, icing, and rest. Cycling and gentle exercise can also be beneficial. Injection treatments such as cortisone, hyaluronic acid, and platelet-rich plasma (PRP) may provide relief for some patients. These approaches focus on managing symptoms and improving function without resorting to invasive procedures. While surgery is not always the best option, it may be necessary in specific cases. For example, if a meniscus tear is displaced and causing other issues, or if conservative treatments have failed, surgery might be considered. In some cases, osteoarthritis is so advanced that knee replacement is more appropriate than meniscectomy. Doctors carefully evaluate each patient to determine the best course of action, balancing risks and benefits. There are situations where meniscus repair is still necessary, particularly in cases of acute, traumatic injury to the knee joint. In these instances, surgery can restore function and prevent further damage. However, for most routine meniscus tears and pain, evidence shows that alternative treatments are more effective in the long term. This distinction is important for patients and doctors when considering treatment options. Interestingly, the study found that sham surgery, which involved flushing the knee with saline, provided some pain relief. This procedure, known as lavage, may remove cell mediators that contribute to pain. While not a true surgery, it suggests that even simple interventions can have positive effects. This finding encourages further research into non-invasive treatments for knee osteoarthritis. Surgery carries risks, including the possibility of worsening pain, reduced mobility, and increased progression of osteoarthritis. Previous meniscectomy can also affect the success of future knee replacement surgeries. Patients should be aware of these risks and discuss them thoroughly with their healthcare providers before making decisions. Understanding the potential downsides is essential for informed consent. Evolving science of knee osteoarthritis highlights the importance of patient-centered care. Treatment should be tailored to individual needs, preferences, and circumstances. Doctors and patients must work together to weigh options, consider alternatives, and make decisions based on the latest evidence. Empowering patients with knowledge leads to better outcomes and satisfaction. Ongoing research continues to shed light on knee osteoarthritis and its treatment. Scientists are exploring new therapies, refining surgical techniques, and developing better ways to manage pain. The goal is to provide safe, effective, and personalized care for everyone affected by this condition. Staying informed about the latest developments helps patients and providers make the best choices. In summary, knee osteoarthritis is a complex condition, and surgery may not always be the answer. Recent studies show that partial meniscus removal can worsen outcomes for many patients. Alternatives like physical therapy, medications, and injections often provide better long-term relief. When surgery is needed, it should be carefully considered and tailored to the individual. By staying informed and working closely with healthcare providers, patients can make choices that support their health and quality of life.